Hi everyone, so today we're going to have a look at the key question or the key issue in AS psychology, the cognitive approach. And the key issue that I have chosen is how can psychologists' understanding of memory help patients with dementia? So, with a key question and key issue in psychology, it's always some sort of a question that is related to society. It involves you really applying all of your knowledge and all of the theory that you have learned within that approach and really applying it to the discussion question. Okay, so we're going to have a look firstly at what dementia is. Okay, so we've got a bit of an understanding, and then we're going to be using some of the psychological theories and the models of memory really to see how we can understand dementia a little bit better. Okay, so let's start off by looking at what dementia is. So you may know a little bit about it, or you may not know much at all. Okay, so dementia is a chronic disorder, and it's a long-term disorder of mental processes, and it is caused by the really memory problems and brain disease. Okay, it can lead to personality changes and impaired reasoning, but the main thing that it affects is a person's memory. It currently affects about 850,000 people in the UK, but it is on the increase, and by 2025 it is expected to rise to 1 million people, which is quite a big number. Dementia often affects older people, obviously with age, and the symptoms are not always noticeable straight away, and sometimes it takes the spouse, for example, might notice it more than the person themselves, so they might be forgetting little things, around the house, forgetting where they put the keys, for example, or where they put their phone. Okay, but it can get quite advanced very, very quickly. So symptoms of dementia include loss of memory, confusion, problems with thinking and reasoning. So they really struggle with, their thinking and their reasoning, and they often are confused about what they might have been asked or something that they did last time and they couldn't remember it. They commonly live in the past, and they have very detailed memories about certain significant parts of their life that were, special to them. So they might remember the good times more than the bad times, I would say. Dementia sufferers begin to forget more and more as the neural connections begin to slowly stop functioning. So remember, really, in our brains we have billions of neurons, and it is the connection between these neurons which enables us to form a new memory. But with dementia, these neural connections almost slowly start to die off. And without the connection, we can't obviously access our memory. Okay, so occasionally clear pockets of memory are still present, and occasionally they will remember something. Their memory can be triggered by familiar faces, so people that obviously are close to them, smells, songs, rituals, things that that will help them to remember things about their past. They also struggle with, when their dementia does deteriorate, sort of into, older age, they do tend to struggle with tasks such as feeding themselves, bathing, and getting dressed, etc. And especially activities that involve some sort of sequence and order, they do tend to get confused and a bit jumbled with activities like that. Okay, so we've learned a little bit about dementia. Okay, and now what we're going to do is we're going to start using now some psychological theory to see if we can link in or explain what is happening in dementia with some of the cognitive theories. So talk about episodic memory first. So you may want to go back and look at your notes on episodic memory and what it was. Just remind yourselves, okay? So remember, episodic memory was our autobiographical memory. So it's about all of our, special significant life events that we have a memory of, weddings, the birth of a baby, special birthdays, graduations, the day you passed your driving test, etc. Okay, so the episodic memory, this can explain the aspect of living in the past, which dementia sufferers do experience. So obviously living in the past is, dementia patients do experience, living in the past a lot. In other words, they tend to want to relive their good times. Okay, so with episodic memory, remember it's autobiographical memory of events that we hold in our lives. Okay, more recent episodic memories tend to be lost first, but the memories from childhood and the youth seem to be stronger memories, and they seem to be more intact until the end. Really, it is therefore useful to listen to dementia patients' stories, really, and it's important not to interrupt them or, even tell them that, you're quite old now, you're not working, or you're not young anymore. That can be quite distressful for them. So really, I think the best thing to do with dementia is to really go along with what they are saying, and really encourage them to talk about their past memories. Multi-store model. So again, just remind yourselves, obviously the 3 separate stores of multi-store model: sensory, and obviously we have to pay attention in order for that to get into short-term memory, and then that has to be rehearsed to get into long-term memory. Okay, so the multi-store model we can use to explain why patients might forget what they've just been told, as the information was not encoded properly, or they may even have a problem with retrieving the information from short-term memory or even long-term memory. Okay, so dementia patients may say things that do not make sense, and the problem here could be, accessibility. So they may not be paying enough attention to the sensory memory for it to really transfer into short-term memory, or they may not be able to rehearse short-term memory. In other words, it won't go into long-term memory. Okay, it would help patients if questioning was more specific rather than general, as general questioning can confuse them a little bit. So if we're very specific with the way we talk to them and ask them questions, and maybe repeat ourselves a couple of times, that would help them. Okay, working memory model. The working memory model suggests that multitasking would be very difficult, and so to avoid it wherever possible. So with dementia patients, normally what is done is they are encouraged to only focus on one task at a time. So, we avoid dual tasks. Competition between the central executive part of the brain and the phonological loop and visuospatial sketchpad can explain confusion and problems with thinking and reasoning. So remember, with the central executive, the phonological loop, visuospatial sketchpad do have slightly different roles. Okay, therefore, if we are expecting a dementia patient to do all of these at the same time, then really that's not going to happen. Okay, because that will just confuse them. So really, to help dementia patients, it would help them to reduce the background noise when we are talking to them. So turn off the television, for example, or maybe just have one person at a time talking to them rather than 2 or 3 people. Again, this would remove any dual tasking. So they wouldn't have to do 2 different tasks, as in talking and then listening to somebody else while battling over a television as well. Okay, so that would obviously help with improving their attention. Okay, so that's working memory model. So again, go over that again, just remind yourselves really what the components of the working memory model are and how really it can help with dementia. And reconstructive memory. So remember, this is part its theory. Reconstructive memory can really explain dementia confusion, as dementia patients may be struggling to access the correct schemas. Okay, So they might mix up different schemas and different memories. And if somebody asks them about a certain time, they may only remember snippets of it, but then they may almost like reconstruct that memory, or that schema which they had was not quite strong. So it would obviously help patients to describe the cues in the environment, and that would help them obviously to recall the correct schemas. So if you're asking them about a certain birthday, or when their first child was born, just ask them about what was the weather like, what was happening at that time, who was the prime minister during that time, etc. So it's very important to give them environmental cues during that time. Okay. Cognitive stimulation. So what we're going to have a look at now is really how to help, because we've had a look at some of the theories now. So how can we help dementia patients? One of the most important things is cognitive stimulation, and this is done a lot in care homes now for dementia, specifically dementia care homes. Cognitive stimulation often starts by focusing on early memories from childhood and young adulthood. Most dementia sufferers will be able to access these episodic memories, okay? And they are encouraged to engage in activities that will rehearse, go over some of those procedural memories that are starting to fade away, okay? And the idea of reconstructing memory can be applied here in cognitive stimulation therapy, because if memories are reconstructed using schemas, anything that really reinforces those schemas or highlights those schemas will help with the memory. A lot of elderly people do find themselves cut off from familiar things. So, by stimulating their brains and really getting them to do activities to, work the brain will definitely help them to remember things. Dementia Village. There's a link here. I think it's a YouTube link. Yeah, a YouTube link to a video about Dementia Village. That Dementia Village is a care home in Netherlands for elderly people, specifically for dementia, and it's designed in such a way to really help dementia patients really integrate into a little community. It's a bit different to your normal care home, because they are more treated as residents rather than patients. They're free to sort of do what they want to, really. They have different activities for them to do. They can go to have some beauty treatment, salons, they can play bingo, they can take walks. So it's more of a community that they have. So do have a look at that link. It gives you an idea of what Dementia Village is and how that can help with dementia patients. Really, what I'm going to finish with now is the most important thing is, if you had an exam question on this, how would we go about structuring that? What would we talk about? How would we really structure it? So again, just reminding ourselves what we're talking about. The key issue is understanding memory, okay, in dementia patients. So we need to discuss how can psychology help us to help patients with dementia. So the first thing you do is describe your key question. Okay, so describe obviously memory loss, dementia. Give me a little bit of information about what dementia is, etc. Some of the symptoms of dementia. Then you link. Okay, then I want you to pick one cognitive factor. So it could be episodic memory, it could be reconstructive theory, multi-store model, so choose one of them. And then I want you to support or challenge, okay, that theory. Evaluate your explanation by using evidence. Okay, so use evidence from multi-store model or episodic memory, okay, to back that up, and link it obviously with dementia. Again, you also need to talk about, I mentioned at the start, that key issues and questions are really relating to society in some way. So in our answer, we must link it to society. So consider the impact on society. For example, why is it important to combat memory problems? Okay, so think about the big picture here. Explain why those memories are important and how they're formed and how they may be preserved. So think about, some of the therapies, treatments, what we can do to help dementia patients. Consider also the effectiveness of strategies. So obviously we talked about cognitive stimulation. Although dementia is a biological condition, in other words, it affects our neurons and the neural connections between those. Think about the idea of treating dementia cognitively, whereas the cause is actually biological. So think about evidence for that, and think about, should we have a alternative treatment for dementia as opposed to a cognitive one? So should it be biological, for example? And then really you need to finish your answer by a balanced judgment. So rather than your opinion and your view, we need to really look at what the research suggests. Okay, so whether cognitive explanations are good enough to help us understand dementia, or do we need to look at alternative approaches such as the biological approach as well? Okay, so there you have it, your structure and the kind of things that you'd really include in an exam question. Okay, thank you.